Hey guys, this is Noreen Kamran and you are watching my YouTube channel Next Generation Nurses. This is my second YouTube video regarding nurses' awareness of the NCLEX-RN exam. So what it includes? It includes how it is truly operate, why nurses find it difficult, and what the key information is. So if you are planning to take the NCLEX exam soon, please watch my video through to very end to fully grasp the what exactly information is required for passing the NCLEX. So what are we waiting for, guys? Let's begin the topic. So as an international nurse preparing to move to the US, the NCLEX journey is a necessary item that must be navigated to achieve the nurse's American dream, which is the land of opportunity, right? So today I am going to share information about the NCLEX, what is NCLEX and how does the NCLEX test works. So first of all, what is NCLEX-RN and how does the NCLEX-RN test works? So the NCLEX stands for National Council Licensure Examination for the registered nurses that is required for nursing graduates to successfully pass to be licensed as a RN in the USA or in the Canada and nowadays in Australia as well. So how the NCLEX exam works? Basically, NCLEX exam is the computer adaptive test. We should say CAT. So each question received is selected based on your performance on previous questions and based on your skill level. The NCLEX test ensures that the questions are not too hard or not too easy. The test will have minimum of 75 questions and maximum of 145 questions. So you will have up to 5 hours of duration to complete the NCLEX test. Therefore, the first NCLEX question will be relatively easy below the level of minimum competency. If you answer it correctly, the computer selects a slightly more difficult question. If answered incorrectly, the computer selects a slightly easier question. So meaning, it depends on the question how you perform. Continuing doing to this, throughout the test, the computer is able to determine your level of competence. The NCLEX test will continue until a definite pattern has been identified, meaning either a pattern of above the passing standard or below the passing standard. So the maximum number of items achieved has been reached or you run out of the time. So maximum number of items achieved means either it will be up to 145 or either it will be up to 75 or if you run out of the time, which is called route, ROOT route, run out of time, ROOT route. Either you reach to the 145 question or either you reach to the run out of time, means your 5 hours duration is completed, or otherwise you reach up to 145 questions. That is the limit. So when it comes to NCLEX questions categories, so it categorized into 4 questions items. Like it mainly depends on the major client needs category. So number 1 is safe and effective care environment. Number 2, which is health promotion and maintenance. Number 3 is psychosocial integrity. And number 4 is physiological integrity. So keep in mind when you're preparing for NCLEX questions, you need to categorize in 4 sections, which is based on client needs categories. And then accordingly, you prepare for your exam. So when it comes in terms of scoring the NCLEX, so I would like to tell you that NCLEX exam is only the pass and fail examination. There is no numerical score will be provided after the examination. So to pass the NCLEX, the candidate performance report, which is called CPR. If I will tell you in real terms, cardiopulmonary resuscitation, that is really cardiopulmonary resuscitation. If we will get the report and we are failed, this is really cardiopulmonary resuscitation for the nurses, right? You agree with me, right? So in all test plan categories, like what we have discussed previously, like 4 categories we have discussed, right? So one above the passing standard area will not balance a below area. So all state boards have the same passing standard, keep in mind, for the NCLEX, okay? So one state is not easier than the another to pass. It means that if you are giving exam from Texas Board of Nursing and you fail to do so, then if you're switching to New York Board of Nursing, that is not the correct way because every board have the same criteria to pass, all right? Okay, so many nurses have frequently asked questions like, can a candidate can skip a question during the examination it find difficult to save the time? So my answer is no. Candidate have to answer a question in order to move on to other question. Then another, also the concern is coming like, is it true that candidates who receives the minimum number of items and the last item is easy will be fail the examination? So candidates cannot reliably identify which items are easy and which are difficult with regards to the NCLEX scale, because there is certain criteria to see which is above the standard or which is below the standard. So at the end of the examination, a candidate is usually receiving items that they have approximately 50% chance of answering correctly. The candidate's sense of what is easy and what is difficult is relatively to their ability, because the examination is adaptive. Both high and low level ability candidates will think the items at the end of exam are challenging. Okay, also the question comes in regards to the candidate performance report. Bless the Lord, regarding the cardiopulmonary resuscitation, right? So what does near the passing standard means when it comes to the CPR, which is candidate report performance report? It means a particular candidate ability estimate is not clear to the computer above or clear the below the passing standard in a content area. So meaning that computer cannot analyze which state of point you are stand at, either below or either low. So you are at the line. Computer cannot decide. More frequent questions comes also, why do candidates only get the performance report if they fail? So the NCLEX is designed as a screening tool used to identify candidates that can demonstrate that their nursing ability is insufficient to be competent in the practice. So it means that if you are below standard, you will get CPR report and they will let you know that which area you need to work hard next time. Okay, so it means that providing more detailed feedback for candidate who fail is done in an attempt to help the candidate direct their remediation strategies. So now what is remediation strategies? Actually, the remediation is the corrective step where you need to work hard. Remediation strategies means a record of how you will carry or how you will meet the corrective measures. Got it? So audience, that's conclude today's video. I hope my valuable information will be useful to you in some manner. So please like, subscribe, press the bell icon, and comment below if you have any queries. Stay tuned and connected with me because I will be posting more videos. So take care and bye bye.